Hi everyone. Can you all hear me? Thanks for joining. So this actually is our first webinar, right? And I just thought that maybe before we start, I wanted to give an introduction of why we decided to do this. Obviously, a lot of you guys know that we're associated with Annomo Health, which is like a premium healthcare concierge company that deals with not just health, but also lifestyle. And we've been doing work for like 8 years. So over the years, we've actually listened to a lot of our clients talk about things that they really worry about, things they're not really very sure about health. And then therefore we said, what can we do to really help clients and patients generally? So we decided that we'll start this webinars as an interactive session. I think the thing that patients really want is to be able to talk to doctors like they were talking to a friend. And that's the whole idea. And then today we're really lucky because we've got like a beautiful panel of people that I can't even believe they're on this platform right now. I'm so excited that we're going to be speaking to them about something that is very dear to my heart, right? But I'll tell you a little bit about it after this video that introduces our speakers. Thank you. Okay, so I guess we let the cat out of the bag. We're really talking about weight loss surgery and more importantly, weight loss as a whole, right? So this is something I said was really dear to me because I don't know about most people, but I've been trying to lose weight forever, right? Constantly trying to get my weight to be in the right place, constantly dieting wrongly, sometimes actually not even sure what to do, exercising non-stop, and sometimes it just doesn't drop. So first of all, I would like to introduce someone that I met a few months ago. And from the very first day I actually came across this person, I was quite intrigued. He's actually a multi-award winning plastic and reconstructive surgeon. And he's actually called one of the most experienced plastic surgeons in the UK. And he has a nickname that is called Body Transformation. That's why we're calling this session the Transformation Team, right? And he's dedicated a lot of time actually looking at people's body and how to get people's body to look better. And more importantly, he's also a medical director of the very renowned Cryo Clinic. I'd like to introduce Dr. Omar Tilo, who's a plastic and reconstructive surgeon. Thanks, Omar, for coming and joining us today. Hello, Omar.
Oh, hi. Sorry, I just had to meet. Hi, thank you very much for the introduction. And thank you for hosting me and to organize this. I'm very, really pleased and yeah, we'll make most of it.
Thanks, Omar. Thank you so much. So the next person that's going to be joining Omar is also another experienced person. Wow, we've got an evening full of experienced people. The story that is really nice about George is that he was trained not just in he works in the UK as a consultant, but also works in Belgium as a consultant, and he's also been trained in both Athens and Brussels. He's got a PhD. So if you know a little bit about medicine, we're doctors, then we're Mrs. or Mrs. and then we become doctors again, and that's who he is, to be honest, right? He's a consultant in laparoscopic surgery, but more importantly, he's also got personal experience, it says, with bariatric surgery, which is also weight loss surgery. So he's going to be talking to us today, and therefore I want to introduce you guys to Dr. George Vassilotakis. Thanks for joining us.
My pleasure, Chichi, and thank you very much for this invitation. I'm really delighted to join the great team here. And as you said, obviously I have quite a few years of experience of doing weight loss surgery, and I have to say this is my out of my special interest, this is my favorite subject and my favorite consultation because of the perceptions that we can find everywhere in the society, in the media, amongst politicians, even amongst doctors actually, about this issue. Basically, the perception is that it's easy to lose weight. All you have to do is just diet a little bit, exercise a little bit, and that will sort you out, but it's much more complicated than that. And I know that we can help the patients basically to achieve their goals and change their lives. So that's why I'm very excited to join this panel. Thank you.
Thank you so much. Thank you so much again for joining us. So now the last person that's going to join us, but she's not the list person because I've left her at the end for one reason, right? So when you've been lucky to be treated by either Umar or George, right? You're really lucky then. But then for this to really work, it has to be a team, as everything in life right now. And therefore, we were really lucky to have this woman join us, right? And there's a force that she brings in. She's very passionate about nutrition, but more importantly, she's also registered to be a nutritionist. So she's not just a dietitian, like, you know, the people you see that talk about weight loss just because they lost 20 kilos and they think they've got experience. She's actually trained in looking after your metabolic nutrition and understanding what it takes, what you should really be eating, because that's what she's qualified as. And she's qualified both in the UK and Brazil. She actually also studied in the US, which is very interesting for me. Like I said, I was like, wow, that's really great. And her specialist interest is actually obesity surgery. But more importantly is that she takes care of you both pre-operatively and post-operatively. And therefore, we're really lucky for Camilla to be joining us. And the best part of Camilla is that she speaks 5 languages. Camilla, thank you so much for being on the team. And I forgot to mention, she's actually a celebrity nutritionist. So for her to have time to come and join us today is really, really great. Thank you so much, Camilla, for joining. I think you're still muted. Can we unmute Camilla, please?
Do you hear me well?
Yes, we can hear you now, Camilla. Thank you.
Much for the invitation, and thank you so much to be part of this amazing group of doctors and very well recognized surgeon and plastic surgeon and gastric surgeon. And I work a lot with doctors like this, and in this grade of doctors, it's a really, really good pleasure to be together with you talking about a subject that it's really important. And I'm really happy actually nowadays, even more after the pandemic, because people now are realizing how important it is to be healthy. And
the great pandemic, isn't it? I think that pandemic just taught us so much. We all sat at home, right? Literally not going to work and just ate to be happy, because isolation is horrible, I think. So I just wanted to give a bigger background before we start the questions. And I just wanted to explain how today is going to work. So what we really want to do is just have a conversation, like I said, like a friendly chat with Omar, George, and Camilla, just talking about things that is passionate to everyone. And I just want to also recognize that we've got a lot of attendees that have attended. And I think your opinions matter, and we're doing this for you. So if you've been muted and there's no video, but we really want you to send your questions in the chat. And then what we will do is get those questions to either Camilla, to George, or to Omar to just try and address those questions that are really burning in your hearts. I have loads of questions for them, so you guys can't let me just be the only one asking questions. And therefore, we've got Siska here to compile the questions, and then we can also do the questions. So I want to dig in if everyone's happy for us to start. Cool. So a little bit of background on weight loss surgery and why we decided we needed to talk about it today, right? In the 1970s, that was the very first time weight loss surgery was actually introduced in the world. And at that point, a lot of doctors were inundated, right, with information and questions. But I think what's most important when you look at, when people talk about weight loss surgery is whether, is it really a lot of people say, oh, it's the easy way out. Wow, really? You get put to sleep, you have to go through pain, and it's really the easy way out, right? I guess when you think about it as an alternative to, is it really an alternative? I'm not even sure, to exercise and diet, we're not really sure. For me, I think even though I'm a surgeon, the thing that worries me is like the complications, how complex it is, and what can we really do? So today we're going to try and see if, is it really worth it, right? Or should we just start eating and exercising like nonstop, be on a diet every single day so we achieve the same goals? Or do we just say, listen, I give up, I'm just going to live life like normal? So I thought the best way to start out is to start with George, who is like the main person that does like the surgery itself, right? Or is the main, like he's an MDT which everyone's important. So George, I was going to ask, like, how do you decide who is a candidate for weight loss surgery to start out?
Yeah. First of all, I fully agree with your introduction. Weight loss surgery is not an easy option. It's not a quick fix, you know. But for some patients, unfortunately, it is the last and only solution. Obviously, you won't start from weight loss surgery for someone who has issue with his weight and he wants to lose weight, right? They always need to try first to lose the weight through basically what we call conservative management, which is lifestyle modifications, dieting, exercising, changing basically your lifestyle, right? And then, so this is the first approach. But some patients, they have tried that many times in the past, dieting, exercising, medication over the internet that, promise you to lose weight, etc. And unfortunately, they cannot lose the weight. To be more precise, the problem is not to lose the weight. The main issue is to maintain this weight loss in the long term. Because there are many ways to make someone lose the weight. All sorts of diets, commercial available at the moment, medication, extreme lifestyle changes, etc. And most of the patients, they will manage to lose weight. The problem is that they cannot sustain this weight loss, right? And this is the famous yo-yo dieting. So they will lose the weight through all sorts of, programs and diets, etc. But then again, they will regain, right, the weight. There's a good reason for that. It's not that the patients, they're lazy, they're not motivated. Obesity nowadays, it is recognized as a chronic metabolic disease. To be honest with you, not different than ischemic heart disease or osteoarthritis or asthma or diabetes. The only problem is the perception that this is not a proper disease. This is something that the patients, they have done to themselves, and the stigma that comes with it. That's why the patients basically, they're embarrassed to ask for help for the weight, because they feel as if they have failed themselves and their families, and they're embarrassed about that. And sometimes even doctors, they will make them feel bad about the weight. They will tell you, basically, they will dismiss you. For example, when you have a problem with high blood pressure, obviously they will give you lifestyle, advices, etc., but they will give you medication. If you have problem with diabetes, obviously lifestyle is an important element for diabetes, but they will treat you. Whereas when you go and you say that I'm struggling with my weight, they will dismiss you very often. Obviously, now we have raised awareness. We all know that this is a chronic metabolic disease, and the doctors, they will support you. But this is something that is changing a bit slowly, right? So for me, someone who has tried all these methods in the past and has failed, it is a good candidate to be considered for this kind of surgery. Okay. Now, broadly speaking, you need to have a BMI above 35 to be considered for an invasive method like, a gastric bypass or sleeve gastrectomy. But now also we have other less invasive
techniques,
procedures like the balloons, etc., that the patients, even with a BMI above 28, especially when they have obesity-related comorbidities, they can be considered for that.
Okay, thank you so much. So I don't know whether you guys heard it, but while George was talking, he talks about one thing that we all hate, which is dieting, right? Because it means that you don't eat all the sweet foods anymore. So I thought maybe, Camilla, that it'll be nice, because what I heard was that even though someone's considering weight loss surgery, they need to get their diet right. So I'm just wondering what your role is for these patients just before they start the weight loss journey through the surgical routes. Yes, I think so. No, not yet. You can't. Is that better?
Do you hear me now?
Yes, we can hear you perfectly.
So the most important thing when the person comes to the group and to the team asking for the help for the weight loss surgery, it's important to understand what is the background of this person, what happened in the whole life, or to achieve the problem, the situation that she is at the moment facing it. So as a dietitian and also as a human being, everybody like us, we need to understand what makes the person to come in this point of the situation. So what happened with her? What was the frustration that she went through that didn't allow her to achieve her goal before going to doctors and go looking for the weight loss surgery? Was that only frustration, or it was only like a fail, or it was something metabolic that the body didn't just cooperate with that? Yeah. First of all, we need to understand how the body works. How is the metabolic response for this person? This is really important to understand about the background, and also teach a little bit the patients how to behave regarding the food, like in a social life. The biggest fear that they understand is when they do the weight loss, they will never be allowed to eat outside again, eat in a restaurant, or go to their birthdays, or to participate to events with the family. And this is what makes them very concerned about doing the surgery. And actually, it is for a very, very short period of life that is right away after the surgery that you need to focus and understand what is the reason why you did the surgery and how you have to behave facing the new style of dieting. But after all, if the person cooperates, follow instructions, respect the rules after the surgery, this person can have a perfect lifestyle after the surgery. So this is what we have to talk before the surgery for them to understand the responsibility that they are going through to the surgery. Because it's not only, you know, doing the surgery and then the mentality will go together. This doesn't work. It doesn't connect together. So they need to understand that their goal and their focus needs to be together, working together with that, and understand that how is the food relation with their emotion, how much effort they can do to control that. So the dieting before the surgery, it's more about understanding how to eat, how to face the food, how to understand the food. For them, go to the surgery and have some limitation and restriction.
Okay, thanks so much, Camila. Thank you so much. I think there's something that you said that made a lot of sense about, it shows how you guys all work together to actually achieve the goal. So you're thinking, you know, I need to look at what they're eating. I need to look at what they're eating before or after. George is thinking I need to give them some surgery. And what a lot of people never realize is that in medicine, we make this comment that not one, there's no one fit for everybody. Everyone's so unique. And therefore, it's not just about, so she ate only eggs and she lost weight. You've got to understand that person, the individual, and therefore you do a bespoke package for them, which is what makes you the best in the country, because that's what you do, right? And as I always make a joke that says, I always say like there's a difference between Mercedes and Ferrari. So you either go to the Ferrari doctor that is really good, or you go to the Mercedes doctor that it's different. And even though Mercedes is like a big thing, it's still different from a Ferrari. So I think I completely understand what you're saying about understanding the individual person and getting it there. So I thought that maybe a question I should ask George is, what types of weight loss surgery are they? Like there's so many different types of weight loss surgery. And how do you decide which one the person actually fits into? Scott, I think there's a slide that shows the different types that George has sent to us to share with us. If you could show that, please. But George, you can start while he finds it.
Yeah. So basically, yes, we have, there's no one operation that fits every patient, right? Mm-hmm. And we have many interventions available, and we need to find the right intervention that suits to the patient, right? So as you can see here, we can start with the gastric balloon, which is minimally invasive. There are different types of balloon available commercially at the moment. The balloons that they don't require endoscopy or anesthesia, not even sedation. And there are balloons basically that they do require an endoscopy with under sedation, basically for the insertion and the removal of the balloon. These balloons, they can stay into the stomach from 4 months up to a year nowadays. And they're very effective. They can achieve very good results and they're very safe. Then we have the gastric band, which is probably an historical operation. I have to say that the gastric band has fallen out of favor the last few years, and we see less and less of that. And then we have the gastric sleeve and the gastric bypass, which are basically proper operations, keyhole operations. You know, pretty much 100% of the patients nowadays we will perform as through keyhole surgery, laparoscopic surgery. And then obviously there are other procedures which are more invasive, more complex for patients that they present with more extreme BMIs, like the duodenal switch or the SADI procedure. And we also can offer revisional surgery for the patients that they had the previous weight loss operations, balloon, band, sleeve, bypass, and either they haven't gained the weight or they haven't achieved the weight loss that they wanted to, or sometimes patients that they start with a very high BMI, so they've done really well with one operation, but they want to take one step further. So then we can offer a revision surgery. But I will say the mainstream at the moment for the vast majority of our patients will be the gastric balloon, the gastric sleeve, and the gastric bypass.
Okay, thanks, George. I think that makes a lot of
I'm not going to take much of your time, but just to answer your question, how do we make the decision which operation is best for the patients? We have to take into consideration patients' factors. So basically the age, the severity of the obesity, any comorbidities, if the patients they suffer from diabetes, for example, if they have previous surgeries, if they have reflux symptoms, but also it has to do at the end of the day with patients' expectations. How much weight the patients are willing to lose, and what is the attitude to risk, because obviously the more invasive the operations, the better the results, the more sustainable the results, but also that comes with risk that comes with surgery. So basically it involves extensive consultation with the patients, trying to understand the medical background, previous medical history, but also what they want to achieve and what is the attitude with regards to these operations in the future.
Thank you so much. So thanks for sharing like the different types. I think when you were talking, I was just thinking, wow, it's more complex than I thought it was going to be, right? And then something came to my mind, which was like, sometimes all I want to say is that, oh God, just get me a plastic surgeon to just cut off all the fat and I can keep going. So Uma, I'm sorry, I'm going to ask you a question, right? Is there really a difference between like weight reduction surgery and plastic surgery in terms of, are you just able to just go in and take out all the fat and then it's the same as a bariatric surgery or not?
So it's a very good question.
There's a picture. Yeah,
Can you-
sorry, Uma. There's the next slide, please, Scott. Yes, thank you.
So it's a very good question because many people actually confuse the two, the weight reduction surgery and plastic surgery, because they relate the excessive weight to fat tissue. And they think that plastic surgery would be able to remove all that excessive fat tissue from different areas. So commonly I get patients coming and asking to have, for example, liposuction to everywhere, neck, arm, chest, abdomen, legs, everywhere.
You're like,
Once you're talking about more than 2 or 3 places, you think, well, the reason in plastic surgery it doesn't work, or it's that yes, true that it is fat tissue, the extra weight, but the fat tissue first is spread all over the body, so it goes everywhere from head to toes, and you can't have liposuction for everywhere. That's one thing. And the most important factor is that a lot of that fat tissue goes in places where we can't reach with plastic surgery. So it could be visceral fat internally, or it could be even into the muscle, into the skeleton. So even when we do liposuction, still they don't get the slim figure which they want, and it also doesn't have the health benefit doing liposuction. So that's why it doesn't work. Plastic surgery, well, so that's why significant weight loss, it can only happen by reducing the calorie intake, which, like George was explaining, to reduce the surgeries that reduces the amount of food we eat or we absorb, or with the diet, as Camilla is also explaining. So that's the way to reduce the weight. Plastic surgery comes to what we do in plastic surgery. It's basically removing those pockets of stubborn fat, fat pads in some areas of the body where, despite losing the weight, they do persist. So we remove them to achieve that final contouring. And also comes with plastic surgery to remove the excessive skin. So patients, when they lose weight, they end up with loose, saggy skin. And when plastic surgery, we cut that skin, or we do different procedures to tighten. So this lady, for example, the picture here showing a lady before weight loss journey. So she came asking for liposuction. So actually then she went on and by diet lost weight to her stable weight. And then when we did liposuction and a tummy tuck, so removing those pockets of extra fat and tightening the skin. So that's the key message, the difference between the two, to be honest.
Okay, I was going to show, I think there's a slide that we showed about visceral fat, which is the next slide. And I was going to ask you a question on this, right? So let's assume the person's tummy looks this way, right? And you wanted to do liposuction, for example. Are you just able to take out the fat that is like towards the superficial bit, or is there a way with liposuction or tummy tuck you can reach further in? I'm not sure whether how that works. Yeah.
Exactly. So the liposuction, it reaches the fat tissue immediately under the skin and over the muscle. So in this picture, it's a little bit cropped, but it's basically showing you have the internal organs. There's the liver, stomach, and bowels. And around those organs, there is all the visceral fat. That's the internal fat, which can affect the health and also gives volume. So we can't reach that fat tissue with liposuction or even with tummy tuck. Liposuction removes the layer of fat that's in front of the muscle. So we see that red line of the muscle, and then next to it is yellow layer of fat tissue, and then the skin. Those are the areas where liposuction will achieve or will reach. Tummy tuck mostly tightens the skin, so we don't go beyond the muscle. We can't do anything behind the muscle. The only way to get rid of the internal visceral fat would be by losing weight, by reducing dieting or weight reduction surgery.
Okay, thank you so much. And I'm just looking at a few questions that are coming in, and then I'm just going to ask George a question. I know we already talked about surgery, and we talked about like the benefits of, we haven't really talked about the benefits. One benefit that we've talked about is that we lose weight, right? But I'm sure there are other benefits of losing weight. And then I think people are also worried about the complications that can occur from surgery, obviously, because people are getting put to sleep, they're having invasive procedures. Can you just share a little bit of light on that?
Yeah, that's a very good question, Chichi. Basically, what I like to say sometimes during the consultation with my patients is that there's all sorts of benefits with weight loss surgery, and there's one side effect: we're going to lose weight. Because at the end of the day, it's not the most important thing. I don't dismiss the cosmetic benefit of weight reduction at all. I would personally do everything to look younger, smaller.
That's your body.
Yeah, and I'm sure that Omar can find a lot of applications on me. So I don't dismiss the cosmetic benefit of cosmetic surgery or weight loss surgery or any type of intervention at all. But in a way, weight loss surgery is much more than that. The patients, they will be healthier. Weight affects every single part of the body: blood pressure, diabetes, chest, breathing, incontinence. It is recognized as the first preventable cause of cancer. It used to be smoking, the first preventable cause. Now it's obesity. And at the end of the day, after losing weight, patients are going to live longer. So there's a dramatic positive effect of weight loss surgery, not only in the cosmetic aspect, but also health aspect, life expectancy aspect, and a functional benefit also. Quite often the patients, they would say to me, I don't want to become slim. I just want to be able to look after my kids, my godchildren, being able to do stuff that I haven't done for many years, etc. And yeah, and I would say this actually, what is very good is that the best advocate for this intervention, they're not the surgeons, they're the medics, endocrinologists and medics. They will see the results, and basically they are the best advocate for this type of surgery, because the impact is really very, very powerful. So basically this type of intervention, they can completely transform their lives. They can have a better life, they can enjoy themselves. Obviously, because a lot of these patients, they are aware about the body image and the way they perceive themselves and they enjoy life. So there's also a psychological benefit to that. Obviously, this comes with risks. And at the end of the day, it's all about balancing the risk versus the benefit. The way I see it, the patients needs to be well informed. What are the benefits, what we're trying to achieve, and what are the risks, so they can make an informed decision. We need to take a calculated risks. What are the risks of doing the surgery, and what are the risks of doing nothing? And quite often, actually, the answer is very clear. But as I said previously, it has to do also, the patients, they know better. When you explain to them, for example, that there is 5% risk of bleeding, infections, clotting issues, bowel injury or obstruction, sometimes with a need for very early, but with reoperations, reinterventions, etc. And these are the benefits. Some patients, they will tell you, oh, no, something, George, actually, I don't want to take those risks. Some others, they will tell you, something, George, I'm willing to take any risk. I need to change my life. I just cannot continue like that. Yeah. So, yeah. In theory, there's also risk of mortality, death from these operations. Overall, globally, the figure is 0.2%. Actually, we have a national bariatric registry in the UK, so we have to enter the data into a national registry. And then mortality, risk of death from these operations is well below that. It's 0.01%. So, for example, I've been practicing for more than 15 years now. I've never lost any of my patients, but these are significant intra-abdominal surgeries that carries, some risks. It's all about balancing this risk versus the benefit, and the science at the moment, it's very clear that the benefits outweighs the risk by far.
Thanks. I think just for the benefit of people that are just joining, because I think since we started, we've doubled the numbers, right? I wanted to comment on something that Judge says. It's not just about one surgeon doing your surgery if you ever decided to go into surgery. It's about having a team of people, and that's why we've got a plastic surgeon here. We've got a nutritionist, and obviously we've got people that also look after your medical aspects of your life. So it's not because you've got to, even if you're going to go ahead, as well as what I'm hearing, you've got to find people that have the experience and the knowledge to deal with not just your particular needs, but also complications that might arise because of experience is like the best teacher, to be honest. And therefore, they're able to choose who to treat and not who to treat. So I was going to ask the question, right? So the patients lost all this weight, right? Especially people that are like morbidly obese as we define it, right? And then they've got a lot of sagging skin. There's a picture that we saw that we're going to share. So if you're a little bit like not very good with medical things, it might be something to like close your eyes a little bit. Scott, can you show us the next picture, please? Okay, Uma, this is for you because I've seen you do like brilliant work. Like when people call you the best, one of the best cosmetic surgeons in the UK, it's not like they're joking. Like, and I remember seeing a video of you, how you draw stuff before you do it and you get everything together. So if you had a patient like this, for example, right? When do you decide that you can help them with body contouring and getting all this excess flappy skin away? And also you might be also shedding light on how soon would you do this and how long do they have to wait? And do you do it once or in stages? I'm sorry, I'm training a lot of questions at the same time, but I thought you might just cross across like describing it to us so we understand. And again, risk and benefits of like, what are the risks of having this major surgery? Again, following the weight loss.
Yeah, thank you for the question. It's a really good question. So as you rightly said, once the patients lose a lot of weight, then they are left usually with saggy skin, because what happens with the weight, when put on weight, the skin stretches, becomes thin, excessive. And then when we lose that weight, it doesn't retract fully back. It does a little bit, but not fully. So then they often are unhappy with the folds of skin that gets in the way of their clothing or their activities, exercises. They often get some infections underneath the skin, like skin breakdown, and it can really bring them down. Some patients get deflation of the breast, so the breast loses volume and they drop down. And a lot of patients, they kind of, in a way, it pulled them down. So they see the benefit, the health benefit of weight loss, but then when they're faced with these issues, functional and aesthetic function is can affect their life in a negative way. So our role in plastic surgery comes here in two parts, as I mentioned earlier, as removal of any excessive fat tissue, and the second thing to do, as you see in this patient here, is removal of the excess skin, cutting the extra skin and stitching it together. So in theory, it may sound easy, but they are big procedures. So they are long operations, and so patients, sometimes they can have medical problems. They may be just recovering from medical problems, could be diabetic, could have heart problems. So first thing is, when we choose patients to have these surgeries, make sure that they are well enough, they're fit enough to tolerate the surgery, or optimize everything possible to make them as fit as possible to tolerate the surgeries, is treat them medically until they're fit to tolerate those surgeries. So procedures could involve tightening of the skin on the abdomen, we call tummy tuck, or tightening the skin on the arm lift, skin on the thigh, the thigh lift, could be back, upper back, lower back lift, and could be a combination. Each of these procedures, they have also different variations and different combinations. So it is possible to combine some of these procedures at the same time, to do 2, maybe sometimes 3 procedures in one setting. But if we don't want to be operating for a very long period of time, once we have, we try not to go beyond 5-6 hours maximum, then because increases the risk of problems. And also the healing process, the more we do, the more difficult the recovery will be, the higher risks of complications. So to make it safely, we often stage it in procedures. There are procedures which work in conjunction very well. They work together. Most upper body lifts work together well: breast lift, arm lift, upper back lift. Lower surgeries, thigh lifts, tummy tuck, those, they work together in combination, thigh lifts. So we tend to combine them in either 2 or 3 stages, best way of addressing those procedures. And to answer, yeah, that's a good question. I get this question about what is the best time to do it, or when is the best time to do it. Best time is first when the patient needs to achieve their target weight, the weight which they are healthy with, they gain their health benefit. They don't think they can lose more. And then we tend to wait for about between 6 months to 12 months, minimum about 6 months for their skin to recover, to retract in place. For any metabolic changes, they might be kind of recovering from diabetes from this surgery. So wait about 6 months from once they achieve their target weight, and then do the surgery. Obviously, we need to control all things which can increase the risks, or problems. So if they smoke, they really should stop smoking. Otherwise, they get a lot of problems with the healing. If they're diabetes, we need to control their diabetes, make sure it's all bad. And if we can achieve a BMI of less than 30, and that's also a good benefit, because there are studies shows that if the body mass index is higher than 30, they may end up with more complications. So those are things which we look at when we decide planning those procedures safely.
Okay, thank you so much. So Camilla, I've got a question for you, which is, so George has done this amazing bariatric surgery, and patients lost all the weight they want to lose, right? And they've gone to Uma, and Uma has done his magic as always, right? He's transformed the entire body. And then the patient's back to like living their normal life, right? I think one other thing that a lot of patients say, especially when they come to, like, I've had patients that have had bariatric surgery, they've come in to do orthopedic procedures, and they always say things like, like I think one thing that, or they just haven't had their bariatric surgery and we're sending them off there. I think one thing that they really worry about are things like, will they still enjoy their normal meals? Does their eating pattern really change? Do you understand? Is it that they lose their taste bud because their tummy is like smaller for whatever we've done? And I'm just wondering how you're able to make sure that they're eating right, eating the right meals that like they like, and at the same time they are still able to maintain their weight loss goals. Because if I've had all that surgery, I don't want to put it back again and then back to square one again, if that makes sense, right? I'm not sure you can cast some light on this.
Exactly, and I think it's a perfect question that you're asking.
Sorry. We're listening to our patients. We can't hear you, Camilla.
Yeah, wait. Do you hear me now?
Yes, perfectly. Thank you.
I have to activate and deactivate all the time here.
No problem.
So this is a fantastic question that you're making, because people don't understand about eating. They think they're just gonna do the surgery, and then after that they will continue eating whatever they want. Get slim, eating very little, but eating whatever they want. And this is actually not true. They have to compromise themselves eating a proper type of food for them, and understand that some type of food they need to put a little bit by the side for a while until they recover from the surgery, because some can be stimulating, some of them can create some kind of intolerance regarding after the surgery, because of the surgery itself. Dr. Giorgio can say that. So it can be a little bit malabsorptive, so they don't digest so well the food. And typically,
we've lost you again. We keep losing you.
And
Yeah, that's better. That's better. Yes, we can hear you.
there's some type of food actually that they have to be restrictive after the surgery to don't cause any dumping syndrome. That this is a common situation for patients that doesn't follow so well the diet. So when they come to us and they have some symptoms, diarrhea, pain in the chest, feeling, most of them come to me and say that they were feeling they were going to die because they're just eating. And this is basically amount of fat increase that they do not following the diet or eating some sugar. So of course, there are some kind of food that they are not allowed to eat after the surgery because, of course, obviously the body would not do the perfect digestion for that. But besides, there are some food that it's a bit more difficult to digest. For example, the shrimp. Shrimp is something very difficult for the body to do the digestion for at least 1.5 to 2 years after the surgery. Complications as well. And this is part of the risks that when Dr. Giorgio said about, is part of the risks that the person needs to be committed with, that it's not only the surgeon who can give this risk, but it's also the person itself needs to compromise and understand that as much as they respect the rules, eat the supplements correctly, eat the right food, and understand that the food that they are eating can be normal again, but in a certain quantity, in a certain type of food, because right after the surgery, we have a liquid surgery, liquid diet, we have a brand diet, we have a cream diet, and then after all, we start to eating stabilizing food again. So like, so we start, but in a quicker process. So we, and after stabilizing the food, maybe they can introduce all type of food again, normally again. But what type of food they don't do the digestion. So
Camila, are you talking about maladaptive eating or something? Is that what it's called?
yes,
Maladaptive eating. Yeah, I've never understood how it works.
Yeah, well, this basically happens when it's very easy to understand it when someone is not really following the diet.
Okay. Okay.
To respect the supplementation when they have some symptoms. We understand, for example, hair loss is one of the biggest symptoms that they come to us and complain, I'm losing so much hair. Probably because they are not achieving the amount, the certain amount of protein in the food, or maybe they're not taking the supplements. Not good in that. So we have to recognize that. And consequence of the emotional eatings, consequence of social eating, consequence actually of the person, how they behave with the food. They sometimes change the type of food to bring more energy to themselves instead of nutrients, because if you compare eating a bread, it's much more, at the moment, it makes you such more satisfied than eating other things at the moment that can be more nutritional. So they skip meals, they try to avoid to eat something more nutrition, and this can cause malabsorptive and also a misabsorption of the nutrients altogether with the situation. So it's a combination of overeating, eating not good, not taking supplementation, not behaving good, not following with the nutritionist, skipping the consultation with the doctor, skipping the consultation with the dietist. So this is basically what happened with them.
Thanks. So we need to take a break at some point, like after this question, but I thought that it might be worth while we take a short break, if the speakers can think about costs. I think a lot of people, when we talked about this during this webinar, a lot of our clients said, listen, we need to know about cost. So I was going to show something. We know it's not cheap to do it right. I think that's what I assume. So it might be worth us casting eyes on the $1 million question is always money, I think, right? How much is it going to cost to go through the process, being managed properly by, a team like your team, for example? And are these costs actually short-term or long-term? Are we looking at like costs that are running 2 years, or are they just a one-off and then people crack on? I'm just wondering, like, I'm happy for anyone to start first to explain how that works.
Yeah. Shall I start?
Yes, please. Yeah.
Yeah. So Basically, the cost varies depending on the type of procedure. The different types of balloons, they can be anything in between. And we tend to give what we call a package price, which is something basically that, includes the consultation, the dietetic reviews, the operation, the hospital fees, the surgeon, and the follow-ups. And I think the patients are like that because they know in advance more or less what will be the cost for them without having any hidden costs, etc. So basically, the different type of balloons that can be they can start from £4,000 up to £6,000. And the sleeve and the bypass, anything in between £12,000 and £15,000.
Okay, thanks. That's a good number. Uma, what
Obviously, yeah, it depends obviously on the complexity of the case, comorbidities, if they have previous operations, etc., etc.
And does this include like anesthetic costs? So they get proper pre-op assessment,
everything,
yes. Properly. You see them after the surgery, so they know they're being managed by a team that knows what they're doing, and it's not just anybody looking after them. Is the best in the country, to be honest.
Absolutely, as Camila said, the surgery is not the end; it's the beginning of the journey. And as with every chronic disease, because I've said previously that obesity is a chronic disease. The most important thing is the follow-up after the intervention. So, for example, if you have a cardiac disease and you go to your cardiologist, they will give you some medication. You might have, a stent or whatever, but you have to go back and see me every so often. It's the same after this interventions, right? So you have to be in touch with your team, and this is how we can achieve the best results, and also recognize and prevent any complications as soon as possible. Because even if something goes wrong, if there's any problem, nowadays we can deal with that and we can correct it. So that's why keeping in touch with the surgeon and the dietitians and the plastic surgeons post-op, it's paramount for the best results and less complications.
Okay, thanks. Uma, if we need your magic hands and your magic scalpel, what happens? How much do we need to pay?
So because it's quite a complex procedures in a way, like the different combinations, each procedure can have different variations. So for example, a tummy tuck could be a mini, just to kind of mini tummy tuck to tighten part of the skin, or it could be much more complex, extended or circumferential tummy tuck. So that's why it affects the price a lot based on how extensive is each procedure, whether they can be combined together at the same time or not. And so we try and combine these procedures together to minimize the cost. If we do more than one surgery, it's one theater booking, and anesthetic so that will affect. So if we talk individually, for example, for each surgery, so a tummy tuck, abdominoplasty, you're looking in the range of about £10,000 to have a tummy tuck. Thigh lift, also a similar sort of range for procedure. It's big surgery, lot of time in theater, can take half a day in theater to do. But that we do a back lift, for example, around £9,000, arm lift. So these are for each procedure. Obviously, when we combine them, then the combination will be less. And we include everything with the price. So we don't want, the patients to be paying bits and pieces or hidden costs. We like to provide there, so everything at the same time. So it'll be like the surgical fee, the anesthetic, the hospital fee, the aftercare, all the dressings when they come back. So all the follow-up. Those patients, they tend to quite common to get delayed healing with the wounds. They may get wound breakdown. Because everything is stitched under tension. You want the skin to be very tight, and that tension can create delays in the healing. So it tends to need quite regular follow-ups and close observations. So that will be all included within the prices.
Okay, no problem. And I was going to say, Camila, tell me, what do you think?
Me now?
Yes, please, about cost. Yeah, we can hear you.
Now, yes, you hear me?
Yes, please.
The cost of dietitian, of course, we don't go under procedure, so it's but maybe the one that we take for longer term. So that's the thing.
Yes.
So say it's always a pack of consultations that we offer, because it's not meaningful to do one consultation. There is no meaning, because we have to do connection with the patient for longer term. I would say the minimum pack consultation that we can do is 3 months to 6 months consultation in the beginning. So I would say for the pack of consultation can be 500 pounds to 1,500 pounds. It depends. Also, if we want to do some exams, intolerance examinations, etc. So, prices.
Okay, so thank you so much. So the most beautiful part of this is that even though we're being spoken to by like the top guys in the UK, right? We decided that for everyone that comes into this meeting today, that we're going to give them a present, right? And Scott, can you show the voucher that we're giving people today for free? So we negotiated that. For me, I feel like people need to go to the best person. So both Umar and George, and also like the whole team, have said that they're going to give our clients or anyone that joins this, if they ever wanted to like speak to them one-to-one, a free virtual consultation. And normally this costs like anything from like £350 onwards, yeah? But we're going to do that for free, just to be able to get people to speak to them one-to-one if they needed to. So if you had your cameras on, I'm happy for you guys to take like a picture of the voucher, and then you can use it later. And we'll just leave that on for some time. I'm sorry, we're supposed to take a break, but we can't, because there's so many questions, because I think we've actually been speaking for 52 minutes. So I'm going to really indulge you guys that we go through everyone's questions. Is that okay, please? Because people like have a lot of questions. So I'm going to go to, first of all, Anthony Awuno. So there's a lot of people have actually logged in from different parts. I've seen people from Cairo, from Nigeria, from the US, from the UK, like all over the world. I'm like, so thanks everyone for joining. Honestly, we couldn't have done this first one without you guys. Different people, I can see different people's names from different parts of the world have actually joined to be part of this beautiful session. And I must thank like the speakers. Like, I feel like I'm leaving this thing more informed about what needs to happen next. So the first question from Anthony says, if a patient is not satisfied with the surgery that they've already done, can such a patient request repeat surgical procedure? So I guess what he means is that perhaps they're not sure, like what they've done, they're not really happy. I'm happy for anyone to take that question. Can they request that more is done for them till they're happy? And I think, Uma, maybe that's your question, actually.
Yeah, it's more relevant. So, so the way we assess this basically is first, as a surgeon or as a doctor in general, our role or our duty is to provide the treatment. Obviously, we can't guarantee that the treatment will work. When a GP prescribe the medicine, obviously they prescribe it expecting it to work, but he can't give you a guarantee. Obviously, we do the assessment, we do the procedure based to the standards for it to work. Complications do happen, and we do keep a close eye on complications. So that's what part of the aftercare is we look after and treat complications. It's not, we don't make money out of patients' misery or try to make any procedures. If the patient is not happy with the outcome for aesthetic outcome, it comes down then whether those outcomes is up to the standards. It's as we expect as a reasonable doctor or as reasonable surgeon. If I see that something, I look at it and I think, yeah, maybe I won't be proud of what I've done. It's not something which I want the patient to go out and show other people. Then I would do it. Then I'll fix it free of charge, definitely, because I would have wanted to be out there, something which I've done and it's not up to the standard. So we'll fix it free of charge. But then that comes where situation where yes and no, I like it, I don't like it. Then those can be agreed, and obviously can have second opinion. You can have other surgeons putting an input into that aspect.
Okay. Somebody else says that he admits that plastic surgery can increase happiness and self-esteem. But he wanted to know from, I guess, Omar, this is your question again, I'm sorry, if you can highlight some of the limitations, like what are things that plastic surgery might not be able to address in this patient after they've had weight loss surgery?
True. So a big part of what we do in the consultation is to gauge and measure expectations and see what the patient expects to achieve and whether the surgery will be aimed to meet those expectations. So as I said, our aim is to tighten the skin, remove of the fat tissue. We can't guarantee that it will change their life. It won't guarantee that they will be happy because there's many things which people go through their life. And it doesn't mean that if their body is fixed, that they, they'll go out and have relationship and have a boyfriend or a girlfriend. So that's more into it. That's why sometimes we may help. Part of the multidisciplinary approach is to have a psychologist on board. So if there's any psychological background or psychological complexity, it might be addressed by a psychologist. So this is patients who may have body dysmorphic disorder. So patients who they may be very concentrated or very occupied with minor issues in their body, then those things, obviously plastic surgery is not going to help. It's about how they deal with their issues rather than trying and fix that issue.
Okay, thanks. So someone else has said, I have had 4 cesarean sections and have a big or fatty tummy. And she's also done different diets and also has been placed on Ozempic for about 4 months. She believes that she's lost some weight, but could not shift the lower belly. She's also had a consultation for tummy tuck, but she feels like, is that her only option? Is there anything else perhaps George and Omar can do to help? Is there anything, Camila, you can do to help with the lower tummy? Like, this is for 3 of you guys, I think, because you guys are the experts. Because I'm sure every one of you can contribute something to it.
So if I understand well, the issue now is after losing some weight with Ozempic, the patient has issue with the
lower belly, yes.
Low abdomen belly, yes.
Yeah.
That would be, I think, probably for Omar to address.
Oh, Omar.
So obviously, if they need to lose more weight after the Ozempic, then we can proceed with a weight loss operation in combination also with the Ozempic or without the Ozempic. But if the problem is isolated to the lower abdomen with excess skin or excess fat, then Omar, I think, has to take over.
Omar, sorry. You're the
Oh,
one that's it's not us. I just the double surgeons.
I do come across this quite often. So basically, if it's safe to do the surgery, and if the surgery is an answer, then we can do it. So what means?
Omar, sorry to interrupt you. I think she's really worried because she's had 4 cesarean sections, which is like 4 CS, right? That's like 4 surgeries. She's wondering like what she's having a 5th surgery also. I guess is part of what she's worried about about surgery and other options that are not surgical. Yeah, I think that's what she means. I hope.
Yeah, sure. So, I mean, they can still have a tummy tuck if they want, provided there's no other risk factor. So first I'll do check what's their body mass index. If their body mass index is above 30, then the risks of surgeries will be higher, not because of the C-sections, but because of the body mass index. Then I would refer her to Camilla, for example, to start with diet, see if we can bring her BMI for less than 30, then she will get a better outcome from the tummy tuck, and it will be less risky to have the tummy tuck. If her BMI is 40 and she tried dieting, tried to speak to the dietitian and it didn't work, then I'll refer her to George to consider weight reduction surgery to bring her BMI down to 30. I won't operate. I don't do tummy tuck if a patient is above 30, body mass index is above 30, for 2 reasons. It's first, they do have a higher risk of complications. Second reason, they will not be happy with the shape, with the outcome, because they will still have visceral fat. They get a better shape, better outcome once they bring the body mass index to less than 30. But if she meets that criteria, then yeah, tummy tuck would help with the localized issues.
Okay, thank you so much. I was going to, a few more questions I think we've already addressed. Somebody has asked about the cost of tummy tuck and liposuction, which we talked about already. And someone said a really sad thing, that an old friend passed away while getting weight reduction surgery. What are the risks associated with weight reduction surgery and how they are mitigated? I think we spoke about that already, but I think what's really important is the whole idea why we're doing this session is actually for people to realize the amount of subspecialty experience that is needed to do weight loss surgery. So I think it's sad. A lot of people have died because they've gone to the wrong people to actually do the operations. People that have little experience, not sure how to manage complications. And as we spoke about, it's not just about the surgeon that does the surgery, but about the whole team. So making sure that they're optimal and they're medically optimized. There's someone that manages complications. So, George, I think that it might be worth just casting a little bit more light on that, because if someone's just asked that question recently, maybe they
yes, I think I've tried to touch upon this previously. Yes, there is a risk of death, of mortality. In experienced hands, as you said, Chichi, is very low. It's extremely low. A global number is 0.2%. The local UK number is much less than that. I tend to quote to my patients actually the global number, which is 0.2%. Now, someone who has a BMI 50, they live 15 years less compared to someone who has a BMI, normal BMI. So it's all basically, it's the patient's decision. Are you willing to take a 0.1% risk in order to live 15 years more? And also it's the quality of life of these extra years that you're going to live, or it's too much for you. It's up to them to decide. I personally, I've been doing, for more than 15 years now. I've done, I don't know, thousands of these operations. It could be 10,000 of these operations, right? And I haven't lost a single one of my patients, but it might happen. It's true. I would have been a liar to say that when you do a major intra-abdominal surgery, because it is not simple surgery, but because of the fact that we were using keyhole surgery and the experience and also the technology, we're using sophisticated, basically, equipment to do the joints, to cut the bowel, to do the dissections, etc. Actually, they have become very safe. Just to give an example, even after removal of your appendix, there's a risk of mortality, which is probably higher than having an elective weight loss operation. And I like also to give this example to my patients. I said, do you drive? They say, yes, most of them, they drive. I said, you know that you're taking a calculated risk because you're driving, because if you come to my hospital, St. George's Hospital is one of the major hospitals in London. We have trauma center, we have helipad, etc. Every day there's someone who dies because of a road traffic accident, but I choose to drive. So I think overall, if you weigh the risk versus the benefit, the evidence suggests that these operations are, it's worth the risk. But again, my aim is to give the patients very honestly, very openly, the pros and the cons, the risk of having complications, or, and then it's up to them to decide. I personally believe that it's worth the risk.
I think that, like we said again, and we can't say it's more, like, you need to go to the right place. You need to go to people that have the experience. You need to have a multidisciplinary approach. It's not one person. The nutritionist has to be there to make sure you're eating right, because at the end of the day, you can put the weight back on again. You're doing the surgery, you've got an anesthetic team, you've got someone that makes sure the cardiovascular is right before they go in. And I like every practice that I've been involved with as an MDT, we will say that the good surgeons will tell you, if it's not going to be able to, for us, if we don't think you can do it because you're not medically fit, then we're not going to do your operation. Does that make sense? And that's the whole idea of not one hat fits everybody. So it's all individualized. It's all about an MDT approach, right? And to get it right. And I think that's really important. I was going to ask, somebody else asked about excessive weight loss and skin removal. We've talked about that already, but there's also another question saying, how much fat can be removed from liposuction? What's the maximum amount of fats in kilograms? That's quite specific, I think.
So in theory, can remove as much fat as there is, but there are some studies to show that once you remove more than 4 liters of fat tissue, then the risks are higher in terms of complications, fluid balance. So usually when it's up to 4 liters, surgery can be done as a day case surgery safely. So patients can have it done and they go home safely home. If we are looking at liposuction volumes more between 4 and 6 liters, we tend to keep the patients overnight in a hospital for observation. Once the liposuction is more than 6 liters, then it's not the right procedure to do, because again, it's not a weight reduction surgery. If there is more than 6 liters of fat tissue to remove, then the answer would be most likely to be better done by weight loss rather than liposuction.
Okay, thanks. Camila, I think there's a few questions for you, which I think you've already addressed. You talked about, are there foods we wouldn't like eating? I think you talked about that already. But someone has also said, how do people control hunger? I'm not sure if we talked about that already. Is there like a special diet that help them control hunger after? And that's really, I think, the not food we can't eat, we've talked about already.
Well, when you control the hunger, it's because you have been treating even before the surgery. So
Okay.
you surgery here as well. So that. Basically, it's because when you create new habits, a new lifestyle for yourself after the surgery, this will be very natural for you. It will nothing be forced. So it will not be something that you were and when you look something that you were feeling sorry for yourself that you are not able to eat. It's just something that you will be understanding that you cannot eat, and your body will understand that too. So as a surgery, as in the digestive system, you can.
Lost you. We stop hearing.
Again, now it's good.
Yes, better.
When you do the surgery, digestive surgery, this is of course anatomic procedure. You also have to do.
I mean, we lost you again.
And now.
Yes, better.
So mentality together with the surgery. So if you are being treating before the, you will feel yourself naturally. So I don't think this is an issue, and I don't have problems with the patient like that. Only if they have bad habits. If they go for bad habits, then they will have a problem with that.
Okay. I think like I've totally, honestly enjoyed today. That's the truth.
Gigi, would you mind if I just give my view on this?
Okay, tell me.
Because this is a very key question, actually. Because at the end of the day, is that how these operations work? Who controls your appetite? Who controls how much you can eat? Who controls when you feel full? It's your brain. So the organ target of weight loss surgery is the brain. But that has nothing to do with depression or, because it's the brain that controls our metabolism. And how these operations work, we used to have a mechanical approach that basically it's all about making the stomach smaller, and that does the trick. That's not true. The body will find a way around restriction anyway, right? Now, and because obviously obesity is the #1 health issue in the world before COVID, obviously, but that will continue to be. There's a lot of research going on. So what we know now is that these operations, they don't work by restriction. They work by changing the signals that comes from the gut into the brain that regulates your appetite, your satiety, your absorption, and everything. So, and we know that's not theories. We know exactly which type of hormones we can they change after this operation. So, for example, GLP-1, PYY, ghrelin, leptin. We know exactly what's going on. So, how you can control your appetite? Because we're going to change the signals that goes from the small bowel, from the gut into the brain. And what seems to be now almost impossible, like pushing the elephant up the hill and failing all the time, it will be much easier after these operations because we change the hormonal environment. This is how it works. And if you don't do that, you just mimic dieting and restrictive procedures, which they're deemed to fail.
Well, thank you so much. Sorry, before I was going to round up, I'm going to take one more question. The person has asked if the best approach would be fat removal or weight loss. I believe exercise and eating habits will be helpful. Thanks so much for this question. I think we talked about this in the beginning, that exercise and eating habits are very important. But this surgery should really only be for people that have tried every single exercise, every single diet, can't just lose weight, and actually their life needs a change. Because as we all know, obesity is the new pandemic, right? It's bigger than COVID, right? And it's like really impacts on every part of your life. So I think we talked about that earlier, and I think that was also a really great question. So I was going to say, like, thank you, a lot of thank you to like all the participants. We had over 50 something people joining across everywhere, which is we're really grateful that you guys came. And I think the questions have been really like thought-provoking, to be honest. And I don't think we're going to be able to address all the questions today. So I thought we should like call it a night tonight, and then we'll try and communicate with everyone, and we'll do another session perhaps next week if I'm not asking for too much, right? Well, I'll speak to everyone and see how that goes. And I was going to ask if the speakers and the team still stay on, and we're going to go out to a breakout room just to have a bit of like things that we talk about how today went actually. But I was just going to say thank you to everyone. Please also remember that there's a link that our technology team have sent that you can use to register for the next webinar. Also remember that if you thought you wanted to speak to either Mr. Tilo, who is a plastic and reconstructive surgeon, and he's like we're really happy to have you, Omar, because you're like classed as one of the best in the country. I cannot believe you're on this platform. And obviously George is like really super experienced. He's like I don't know how to explain, what word is it? Like the guru of bariatric surgery in the UK and also in Brussels, right? And if you wanted to like have a one-to-one chat, they're going to offer some free consultations, which we put the voucher out. And you can always like, if you're not sure how to use it, you can email webinars@annomohealth.com. And that's normally also on your registration when you registered into this webinar. And I cannot forget Camilla. I've actually, like, Camilla's team are constantly on TV in the UK. And when Camilla says, I'll come, Chichi, I'll come and like talk on this, I was really grateful. Thanks to you, thanks to Rachel, who also, you guys all work together as a team. And what we're taking back from here is that medicine is no longer one doctor knows everything. It's all about MDT, which stands for multidisciplinary approach team, where we all sit down and say, okay, this patient needs to have this operation. Is that the right thing for the patient? Are there things that like the anesthetics and say we need to change? There's things about cardiology before we actually go ahead with surgery. And I think for us who hear a lot of stories about people dying from surgeries that I see people do really well from, I think it's really important to drive home the fact that this whole webinar, the whole idea is that I want people to see medicine, what it should really be like, first-class medicine. In your own home, you're listening to the best people talk to you about it. And going forward, that's what we're going to do. We're going to get people come and talk to you about how they work in teams to achieve the goals that they're achieving, and how you as a client, as a patient, should only ask for the best doctors to treat you. And health is wealth, right? They say, and health is the foundation of our entire existence. And that's the whole idea. And obviously, if you have any questions, we put it in the chat box where to write to. The vouchers will be emailed to everyone, whoever wants to use it, or you want to share with a friend. It's actually, we've got a lot of them and we'll just keep a tab on that. Thanks everyone for coming again. And I'll ask the speakers, please, and the team to please stay. And Scott is going to take us to a breakout room while people sign off. Thanks everyone. And we hope we'll see you soon. Thank you. Bye.
Thank you. Thank you.